Scrutiny Committee. Before we get into the agenda, I think as always it would be a good idea for us to go around the committee members and the people sat at the table just to introduce ourselves. Reminders to members tonight that we're not on camera tonight, but we are on radio, as it were, being recorded by audio. So when you make contributions tonight, either I'll try and make it clear who's speaking, or if I don't, if you could as well, that will help, I think, with record keeping, etc. as well. So we shall start with David and then work our way around.
Good evening, I'm Councillor David Noakes, I'm a Cathedrals Ward Councillor, and I reserve for Councillor Ben Johnson.
Councillor Maria Lee, Cathedrals Ward. Shelley Burt, Scrutiny Officer.
Councillor Gavin Edwards, I'm Chair of the Committee.
Norman Coombe, I'm the Legal Advisor.
Ellen Kerslake, Councillor for Newton Ward. Rebecca Lewis, Councillor in School.
Tom Flynn, Councillor in Campbell Green.
Jasmine Ali, Councillor in the Lane Ward.
Kieran Williams, Councillor in Campbell Green.
Martin Weckl, Anglican Diocese of Southwark.
Thank you, everybody. So moving on to our agenda. In terms of apologies this evening, so we have had apologies from Ben Johnson. I've had apologies from Councillor John Hartley as well. Are there any others, David?
Apologies for lateness for Councillor Rosie Schimmel.
Okay.
Probably from latest for Paul as well.
And Councillor Paul Fleming as well. Okay. Moving on, item 2, notification of any items the Chair deems urgent. I haven't been notified of any further items, other than things that are on the agenda already. Disclosure of interest and dispensations. Are there any members of the committee who have any interest or dispensations they would like to declare? Okay. Moving on to the minutes of the previous meeting on the 9th of October. Can we agree those as a record of the meeting? Agreed, thank you. And moving on to item 5 on our agenda, which is the outcome of the consultation exercise on changes to the day centre provision at Queen's Road and Riverside and the development of a disability hub. And this is a call-in item, which necessarily is the first item on the agenda according to the Constitution. And the way I'd like to do this, I think, is we have the reasons for the call-in in the papers, so I'm going to assume everybody has read those and done their own analysis of that. If we could start by asking the Cabinet Member and any other officers to come up and first of all introduce yourselves.
Thank you, Chair. Councillor Richard Livingstone, Cabinet Member for Adult Care and Financial Inclusion.
Good evening, I'm David Quirk-Thornton, Strategic Director for Children and Adults.
Thank you, welcome. The way I'd like to do this evening, in a moment I'm just going to hand over to Richard and David just to for you to give us your initial responses to some of the points that are in the call-in. Unusually, in this case, I think the number of points in the call-in reasons are very long, and perhaps if we have sometimes when we have 4 or 5 reasons for a call-in, we're able to kind of use those as a kind of part of our agenda for this particular part of the meeting. I don't think that's going to be practical on this occasion, but I'd like to get your response to some of the points that are raised in the call-in, and then we'll go into questions from members of the committee after that. So first of all, over to you.
Thank you. I think I'll start off and David will probably chip in. I think, first of all, it's worth recounting why we're consulting on this matter. We've been through 2 different rounds of consultation on this. That consultation has always been about making sure that decision in changes of services were safe decisions and decisions which looked at all the issues properly and fully. It was obviously never a referendum because we always knew, as you have in any change of service, that the likelihood is that most people will come back and say, no, we like things as they are. So it was never meant to be a referendum. But I think what has been very clear, as you'll see from the report that we have, is that all of those issues that surfaced during the consultation, I think, have been responded to and considered carefully. The process has obviously started back at the beginning of the year when we had the notices go out to the Camden Society for both centres, both the Queen's Road and Riverside, for the Camden Society to leave those premises. In both cases, the leases had come to an end. There was a tenancy at will, effective arrangement there that hadn't been fully formalised.
Mm-hmm.
At that point, we didn't think there was a need to continue the usage of those centres. It became very clear, I think, as we listened to people and the concerns that the community had, that we needed to look at that very carefully. And I think through that process, through the large number of meetings that we've had with the Camden Society, with the parents and carers, that we have changed our views and addressed some of those issues. So we are no longer closing Riverside Centre. We are now actually gone to a point where we are offering them a 20-year lease. Mm-hmm. David and I and some other officers were in discussions with the Chief Exec and the Chair about that yesterday. A very clear change that has been to our approach to this as things have developed. We have also, as you may know, originally looked at operations ending at Queen's Road on the 30th of June. We have obviously gone a long way past that date, and and there still isn't a formal decision for when that will end, although I think the likelihood is that's probably a decision that we're coming to very soon. That's a decision that will be taken by property in terms of that Queen's Road. It's also worth remembering that actually the purpose of this is to look at the sustainability of daycare provision in the borough. We're actually relatively unusual amongst boroughs. We're certainly, it's not the case that every London borough even has daycare provision. I think a majority of boroughs now have got rid of daycare provision altogether. In Southwark, we've taken the view that actually daycare provision is something across different user groups is something that's valuable, but it needs to be sustainable. Last year we went through the process in terms of establishing a mental health care hub, so that our mental health care division was delivered through a central hub at Thamesreach, with a satellite provision at a number of other sites around the borough. We are working with the community and voluntary sector and having discussions about how we might reshape daycare provision for older people at the instigation of the voluntary sector. So this is fitting in establishing a disability hub to sustain daycare provision is something that very much fits that pattern. But there is a real reason to do that, and that is because both the Care Act and what comes out of that in terms of the fact that people need to be reassessed, and we know that when people are reassessed, that because we are no longer making provision under the Care Act for people of moderate needs. I know we've had this discussion before in the Communities Scrutiny Committee, but because because that is what the Care Act says, we know that, along with trying to address our own budget pressures, and there is a £537,000 saving attached to this that the Council agreed in February, that we need to look at these matters in a way which enables the service to go forward in a sustainable way. We have 3 centres in the borough at the moment that deal with disabilities. We have Southwark Resource Centre at Queen's Road. We have Riverside. We, of course, obviously have other provision for people with learning disabilities around the borough as well, other sorts in other locations. It's clear that those 3 centres have excess capacity at the moment, and as we go through the process of assessment and actually people making different choices of their life as well, we know that younger people now, there will be younger people that leave school that want to have daycare provision, but there are increasingly numbers that no longer want daycare provision. Instead of having that default to daycare for people that leave special education with learning disabilities, they're often opting for apprenticeships or other alternative activity rather than daycare as well. So we know that the need is going to shrink over time. So therefore it is sensible, if we're going to have sustainable services which can remain financially viable and are not empty buildings that people or buildings are underutilised, that we have that review of provision It's something I think we've gone through very carefully. I think it's worth restating that we think we're certainly not saying that everything has gone right in this process all along. I think early on there were mistakes that were made in terms of how the notices were issued to the County Society about the leases. That's something I've been on record a number of times apologising for, but I don't think it hurts to apologise again for I think the mistakes that were made there. I think as well, you know, as you will see from the papers, I think we have apologised for perhaps a slowness in the response for the environmental regulations information request.
Yeah.
Yes, and I think, you know, it's worth being very clear up front that that is something that I think we ought to be more speedy at providing as well. But in terms of the soundness of the decision that Cabinet took 2 weeks ago, I think there's a very strong rationale for the way forward that we're taking. I think the fact that we've been through 2 consultations means that we have had every opportunity to surface issues and concerns and make sure those are properly addressed, answered and properly considered, and for us to question ourselves on issues that arose from that. I think the fact that we've been to a number of public meetings to address people's concerns and to listen to those. I think the fact that we have met many times with the County Society of Parents and Carers group, including taking them around the Southwark Resource Centre on the 15th of August to look at issues and to go through the Parents and Carers group any concerns they might have about the Southwark Resource Centre as a hub. I think we've actually done everything that we need to do to be able to make a sound decision at the Cabinet meeting 2 weeks ago.
Thank you for that introduction. David, did you want to add anything at this stage?
I would add just a very little piece which I think is important context, which is around the Care Act and the fact that the approach we have to take, as all local authorities have to take, is individual assessments and reviews of service users. So whilst at one level this is consultation with a wide number of stakeholders about decisions which could in turn affect the future of one of those services now, it's really important that we don't lose sight in this. The Care Act does require us to do assessments, and like we acknowledge the good work of the social work team in undertaking those assessments. I know this has been a difficult and challenging process for all involved, for services and for family carers in particular, and indeed for the staff of the Family Society. So I absolutely recognise that. And I know colleagues have taken great care and attention to undertake those assessments sensitively. Inherently in this context it's difficult, and I would absolutely acknowledge that. But the basis for our approach in terms of adult social care here is person-centred and based on individual assessments for all of those clients, and then brought together to give us a clear picture about what we need in the borough, and really a clear assurance around the eligible needs of all those services being met at Riverside, at Southwark Resource Centre, at Lead, at other services. And that's the way this would follow through if it goes ahead.
Okay, thank you for that. That's very helpful. So, in my own mind, the issues around this decision, I think, fall into kind of 3 main groups. First of all, issues around the decision making over the property in the first place, and the way that people were notified about certain decisions around that. Issues relating to the consultations, including information sharing during those consultations, and also, I think most importantly, issues around the quality and scope of the provision that's going to be provided at the new hub. So that's kind of broadly that's how I'm grouping it in the way that I'm thinking about it. I'm going to jump in with a few questions, but if members of the committee want to indicate to me, I'll put you on the list to ask questions when I can. So I'm going to start off with the last of those. First of all, with just a straight out question: can people who are going to be receiving services and their carers at the hub be reassured that they're going to be getting high quality services, and that the people caring for them and helping them with their care are going to have the right training in order to do their jobs?
Straightforward answer is yes. The Southwark Resource Centre is a council-run service. opened just a few years ago, costing £3.6 million, purpose-built for people with disabilities. And in terms of the staff team who are there, they are experienced and very well-trained social care staff employed by the council, line managed by a qualified occupational therapist, and they have extensive training in the range of skills that you would need to be caring for people's needs. It's probably worth me explicitly calling out the issues around physical disability and learning disability. And I approach that not just from a theoretical perspective. I have managed 2 learning disability day centres. I've managed a multi-purpose day centre, which is a day centre for people with learning disabilities, physical disabilities, mental health needs and older people. And then for 5 years in Hertfordshire, I was the area manager for all-day services in one half of the county, so 16-day services. So I've got quite a bit of experience in terms of learning disability day services and mixed multi-purpose alternatives day services. The core skills that are required to meet someone's needs are social care skills, and we train through BTECs and through other qualifications and courses. We train staff to be social care workers. We no longer in England train people to specialise in learning disabilities, or the old very crude registered practitioners, registered nurses of mental handicap as was some years back.
Yes.
These are the qualifications that we had.
Yeah.
We had separate training for people with learning disabilities, separate training for people with physical disabilities. That has gone 2 decades ago, and for a very good purpose. Because the whole journey for people with learning disabilities has been one of inclusion into society. And so what people have needed is well-trained, competent social care staff, and sometimes that veers a little into what might be regarded by lay people as the medical. So for example, giving medication and giving certain types of medication, for example, if someone has epileptic seizures, needing quite intrusive support. But social care staff are trained to do those kind of tasks to directly meet the needs of people with learning disabilities and people with physical disabilities. In terms of a building, the issues for a building are about accessibility. So in terms of the multi-purpose £3.6 million building that we run, that is as kind of good as it gets in the modern age for buildings. There are understandably some questions about safety for people who perhaps may wander or who may not have the competence or capacity to make decisions, about safe wandering or exiting buildings. And it is true at the moment, you can access the whole of Southwark Resource Centre because it hasn't been necessary for us to zone off areas and to make them more secure. But in this consideration, we have looked at that. We've costed, and it's very, very small amount of money for us to be able to zone off. This
is the £40,000.
£40,000 at the back of the building, which is where the structured day service will be happening, for us to easily adapt that. I think anyone who's been to visit Southwark Resource Centre in Queen's Road can clearly see a very big difference in quality, not just of the fabric, but of what's on offer and what activities can take place there. And I do think that it's worth recognising, yes, of course, there's a relationship and experience for the staff at the Camden Society. And there's also a lot of experienced staff at Southwark Resource Centre. And throughout this report, we have clearly identified that if David is going to Southwark Resource Centre and David has some particular needs, that we will support a smooth transition, including shadowing work and handover from key worker to key worker. But if any training is required so that David can be safely cared for, then we would cover that off through our training programme, which is already quite extensive and easy for us to access. So the foundation of this is the support and care plans. So for each client to be transparent, they would have a very explicit support and care plan, and we would cover off how we meet those needs.
Just on that point, one of the other issues that's been raised with us is that and this is quite a serious charge, I think, is that user assessments in terms of deciding what care people need and assessing whether or not those needs can therefore then be met at the hub have taken place without carers present, and which is obviously quite a serious charge. I mean, is there any truth in that?
We've heard that statement being made a number of times, and every time I hear it being made, including at Cabinet when this decision was taken, I give the same response, which is, we are not aware of that happening at all. We would be very surprised if that happened. So we have invited evidence from parent carers, we've invited evidence from counsellors. and none has been forthcoming. So we've heard this anecdotal statement of some of the assessments have been undertaken inappropriately or in breach of the Care Act. It is a serious allegation because the people undertaking those assessments are qualified social workers,
Yes.
they're registered professionals. They take their job very seriously. It's a vocation, not just a job. So these are really serious allegations. And to date, no one has brought any evidence to my attention or Jay Stickland's attention to back up those claims. So I'd repeat my offer tonight for anyone who wants to say that. Give us the information, we would look at that. Of course we would look at that. And if we need to take action, we would take action. But given that I know that staff at the Camden site have been involved in the process, parent carers have been involved in the process, we're talking about Queen's Road and the decisions tonight in terms of the decisions to set up a disability hub and the consequential impact of that on Queen's Road. Assessments have largely yet to take place at Riverside.
So,
we were talking about Queen's Road.
And I'd certainly want to add that I would take it very seriously indeed if it is true that assessments have taken place without carers in place. I think we would all be very concerned about that. It's clearly, if I ever had evidence of that, that's something that I would want to follow through. I also think, certainly if there are, it's something in mind, I think, all councillors, so that would be a serious safeguarding issue. And so if any councillor was aware of that information, they would certainly need to be, I think we'd all have a responsibility for putting that forward and looking at it. As David says, I think it would have very serious professional consequences for anybody that have done that incorrectly, because it is clearly a very significant safeguarding issue for me. I think it would clearly be a gross dereliction of professional duty if that was taking place.
Okay, that's a reassuring response. I did see a couple of people indicate in. I should have said at the start, if there are any kind of individual points that people want to make, people who come along specifically for this item tonight, I will give you the chance to do that once we've had a discussion with Richard and David. So I will come back to you. And last one from me in terms of the quality of care that people are going to be carrying out. Has training? Is there more training to be done in terms of the staff at the new centre, or are they already in a position whereby they are able to take on these staff? The reason I ask that is because another point raised in the call-in is that the council hasn't published a strategy for the transition of services from Queen's Road to the hub. So if you could give us a response to that, that would be useful.
In terms of the training point, I'll come to that first. Yeah. So the staff have completed their core training for social care. There's nothing outstanding there. What is important to say though is when we're clear about what clients are coming over, because it's a choice, in order to come over, those clients would have to elect to give up a direct payment and to come back into council care, because it's actually not legal to spend a direct payment on a council service. So in order to access Southwark Resource Centre, they have to give up their direct payment and say, I want to come into council service.
Yes.
So when we're clear about who's coming over, then we can check their care and support plans, and if there's any other training that's needed because of an individual client's very bespoke needs, of course we can easily do that. But all the core training is already completed.
Can I just add to that? I mean, I met with staff at the centre that were actually would be involved in the day-to-day care of people at the Southwark Resource Centre back at the beginning of October to look at the progress on this. It's obviously an issue that I was very concerned of, to make sure that proper transition plans are in place. I was given what is quite a sizable risk analysis there. I probably can't share this with you, but it gives you an idea of what there is, all the actions that are taking place to address all those issues, to make sure that things would be fully in place and ready for people transitioning across. When we met the Camden Society yesterday, we talked then about how we would take forward those individual arrangements that David talked about, and what the channels for discussing those individual transition arrangements would be between the Camden Society and Southwark Resource Centre for those people that would be transferring across. And so we've got very clear who's responsible in both Camden Society and the council for taking those discussions forward.
Thank you. Okay, so I've got Kieran and then Jasmine.
Thank you. Obviously, a series of the reasons given in the call-in are about the consultation process, and you've gone through what has happened over the following months. I suppose I wanted to step back and go, I think when you came, David, to this committee around budget time, we had a conversation on the consultation piece. And you said quite clearly then that there were limits on the level of consultation that could be done because of the Care Act and how that worked. I just wanted to ask, are we comfortable that the consultation process that has happened since then fits with those requirements and has gone above and beyond what the council is statutorily required to do?
Yes, so you're absolutely right to call out that the decisions that we make for individual people with eligible needs has to be based on their assessments. And then when all those assessments are complete, as they have been at Queen's Road, then we have the group picture, and then we can have those discussions. And in terms of the consultation engagement that's taken place, it's been very extensive. And I suppose I would point to the second consultation, the further consultation we did, because despite the efforts and the work in the first consultation and the various meetings, there was feedback that some elements were not clear. So we looked at that feedback and we gathered and took some advice and guidance again about how can we directly respond to that. And it became clear that we would need to do further consultations. So we did for 4 weeks, we did a further consultation, which was making really explicit to folk that yes, if a decision was made to set up a disability hub, that would almost certainly mean that we wouldn't need the service at Queen's Road, which could lead to its closure. So we wanted to be transparent, although the decision is not about Queen's Road, because it's not a commission service, the council doesn't have a contract with it. The complexity and the confusion for some people that we're the landlord for the building. So of course the council would have a relationship, but this is not a commission service that we would consult on, like a suggestion to close a council day centre or a suggestion to end a contract. There would be very set consultation engagement processes that we'd have to go through for that. But in the terms of a service that's accessed by people with direct payments, we have certainly covered off our duties in terms of consultation and engagement. And I think we've demonstrated by going out for 4 weeks further consultation that we've responded to the comments we received, which was that the first piece of consultation wasn't as clear as it might have been. So I'd say we've been at pains to demonstrate that we are listening, and indeed for the change that will be made in the process that we've responded where we can. And of course, separately to this, what isn't captured here is the work we've been doing with the Camden Society, where we've been trying to work with them to cover off the various risks and issues that they face in this, because they're in quite a vulnerable position. All the clients that the Camden Society could give a month's notice today and walk away, and then they have no income for those services. There's nothing else more solid underneath those services than 1 month's notice. And the clients can do that. So we recognise difficulty therein. So as well as the kind of formal, official, public consultation, we've been speaking with the Camden Society, we've been trying to work to hold everyone through this process. And in terms of, yes, changes to day services, establishing disability hub and the consequences of that, I think we've been fairly extensively in our approach.
One more, Kieran, yeah.
And just to follow up on one specific that's cited in here, so there's a statement in the reason to call in that says it's not clear how the user assessments were commissioned, whether they were independent or whether they were accurate. Whether you could just respond to that specifically.
So I would say they are accurate. They've been undertaken by staff in our learning disability service, as is normal in these circumstances. Those staff are qualified professionals with considerable experience in working with people with learning disabilities. They're not generic practitioners, so their background, their experiences in working with people with learning disabilities. They've used appropriate assessment tools, we've quality assured those, and we have audit processes. And decisions then on eligibility and personal budgets, from which direct payments come from, are then looked at a panel, which has very senior managers on it. That process engages service users and their families. So sometimes there's some toing and froing and some debate and some discussion about what David needs and whether that's been accurately captured or not. And so that's the process that is undertaken. The question about whether they're independent or not is an interesting one, because the duty for people with learning disabilities in Southwark is with Southwark Council. It's not with an independent body. So we have the duty, and we empower professional social workers who are licensed with the Healthcare Professionals Council to undertake their professional duty. And they have done in this regard. So I would say not just have they undertaken their work, but the quality assurance and panel process is quite a tight assurance, and it is standard and is fully consistent with the Care Act.
Okay, Jasmine.
Yeah, it sort of follows on a little bit from Kira's question. I think really no one can accuse us of not consulting, I think, but the fact that we went straight ahead and did a second consultation, gave it a bit of a stop-start feel. And what I don't get the sense of is there was any, I'm querying the change management of this really, because we can't talk about being person-centred and then not treat people like stakeholders. And looking at the results of both of those consultations, and people will think what they will think anyway, but what I didn't get a feeling through looking through the bundle was that people were treated as stakeholders. Do you see what I mean? That they were a part of it, that they were part of discussions on what this new hub would be like. And, that felt a bit disappointing because it's not really the way of Southwark not to get change management right, really. So I'm just wondering now, because we can't recreate the past, but I think how, can we rectify this in going forward, really?
I think it's probably worth saying from the outset that certainly in our discussions about developing what the hub would look like in its services, we did engage with service users as part of that before we started the consultation. So as part of our process for developing what the hub would look like, what the services would be there, we did engage with the Parents and Carers group, for example, I think with the Camden Society as well, about what were the elements of that hub that needed to be there to make sure it worked. So I think we have tried to engage in terms of how we work with individuals as stakeholders. I think you're right to call that out. Clearly, once you're in a consultation process, it's very much about what are the questions there and what people's responses to those questions are. And I think, that does feel perhaps a little bit, I can see how you could see that's perhaps putting a bit of distance in there. But we did have that discussion beforehand. Clearly, as I said, throughout the process, we've been very keen to talk to people and to hear their views. And we have changed our mind on some issues as things have progressed and moved on. So whilst I certainly understand why there are still concerns, clearly, for people that have their loved ones at Queen's Road, and perfectly understandable why that's the case, I think we've certainly worked with people to make sure that any decision is a safe decision, that actually services that are provided are fit for purpose, and that actually we're making sure that everybody's needs are met. And I think we those things that we've done beyond the consultation in terms of those discussions, I think has helped us get there.
Okay, thank you.
Thank you.
I'm going to go to David. I'll put you on the list as well. David first.
Sure. So I guess I want to pick up, I want to start by quoting something from the Fairer Future for All, which is about being open, honest and accountable. And the background to where we've got to, just to remind people, is that the Riverside was obviously advertised to developers back in October 2016. The Camden Society received notices terminating its leases for both day centres in January 2017. The budget for daycare was cut by 537 in February 2017. And it wasn't until March 2017, when a deputation came to full council, that suddenly we get into a process of consultation with the service users and their families. On David's point that this isn't council services, the fact is that when many of these people took up their position, took up their service at Riverside and Queen's Road, they were commissioned services from the council. These were commissioned. We originally commissioned Camden Society to provide learning disability things. So I think there is a level and responsibility for us to do meaningful consultation. My questions, I suppose, are, the background to this consultation was a decision that had already been taken to close the day centres and to sell, and effectively to sell them, or to finish the leases. The consultation responses showed consistently that the two, obviously they were massively opposed by service users and their families. But the two biggest criticisms were there was not enough information in the consultations, and the consultation process wasn't adequate. And despite doing that twice, the answers still came back the same. So in what way do you think the council has been open, honest and accountable to very vulnerable service users and their families?
Okay, I'll certainly start with that. As I said, yeah, I think, as David said earlier, when it became clear that people felt that the right questions weren't there in the first, or we weren't clear enough about particularly the implication of the decision from as it was set out in the first consultation, we reconsulted. So we did listen very carefully to that criticism that came back, and we have gone back and we've reconsulted on that. I think
got the same response.
We certainly got similar concerns raised. That's very true. I think that the concerns and how we responded to that is very clearly set out in the report that the Cabinet has considered. That we have each and every one of those concerns highlighted, and there's a clear response on each and every one of those about what our view is on those issues that were raised. I think, as I said in the outset, I think you mentioned Riverside ending up on some property bulletin. That was before any decision that I was aware of had been made. I'm not quite sure how it happened. I can certainly understand why people are suspicious as a result of that, and I think that's why it's been very important that we have tried to talk to people as often and as frequently as we have. I think it's really important that we knew when we took the decision 2 weeks ago that actually there had been a proper opportunity to air all the issues, there had been a proper opportunity to listen to all the concerns, and to make sure that we had listened carefully to those and responded to those. And I think that's where we have got to. I think you are right to call us out on some of those issues about openness. I said that in my opening statement. I think how the notices were sent in January was not good enough. It wasn't the way we should be doing things. And I will apologise again for that, because I think that we didn't get that right. And I also pointed out some other areas where I think that we could have done better in terms of our openness. But I think where we've got to now, and the process that we've actually gone down before we have taken any decisions on that, has actually shown our commitment to openness and transparency. And I think that we have demonstrated it, albeit I would agree that it would have been better if we'd perhaps started off in some of those places earlier on and had those discussions at an earlier stage. And the way some of this information came out initially was not good enough.
Okay.
One follow-up question.
Yep.
So one of the examples that you gave about how the council had listened and sort of responded to the consultations was by saying that that the council were going to had offered a 20-year lease at Riverside. Can you confirm that lease will be honoured and that there will be no future closure of Riverside and there'll be no withdrawal of that 20-year lease?
Yes.